hearing your wife has lung cancer, let alone stage 4 lung cancer, let alone, oh my gosh, it's in her brain, the first thing that goes through your mind is, how do I take care of them? And what do I need to do as a dad, as a husband, as a friend, etc., to make certain that they get through it, that Sophia, our daughter, is well taken care of, that Julie, of course, gets everything that she needs. So you go into almost a crisis mode.
I was completely shocked. I had no symptoms. I had gone for a routine x-ray from my chiropractor, and they found a huge mass in my lung on the right side that was bigger than an orange. And they said, you need to get this checked out right away.
Some of these factors that we're seeing, younger patients, more women, and more non-smokers, is something that many lung cancer researchers have noticed. And we are still trying to identify epidemiologically how significant this trend is, and if there are some features that we can use to explain those changes. Some of them may even be due to ethnicity. There are some ethnicities that develop these mutations at a higher rate. There may be certainly some environmental exposures that have yet to be really clarified, which are the most important.
So I found I had a mass, and then they did a CT scan, and they said, it looks like cancer, we'll do a biopsy. I said, no, it can't be cancer, I feel fine. I went to meet the first time with my oncologist, and he said, you have stage 4 lung cancer with metastases in the bone, in the lungs, and in a couple different organs. I said, different spots in the chest area. And I said, how could that be? I feel great. And then a couple days later, I got a call from him that I had brain metastases as well. So that meant 3 tumors in my brain. And at that point, I really couldn't be shocked anymore. I was just said, whatever, and just hearing stage 4 lung cancer was paramount to just saying, almost to saying a death sentence, as far as what I understood.
The honest discussion is, this is stage 4 lung cancer. This could kill her. And how do you overcome that? Well, A, don't be too proud. Go find yourself help. That's the first thing that we did, was we found every resource we could find, and don't think that you can do it yourself, because you can't. There's a whole world of cancer survivors, of people who want to help, who are there for you, and most of them don't even cost a penny, and they'll just the cost of a cup of coffee. They'll chat with you, they'll help you. We see a psychiatrist, a psychologist, whatever it takes to help you get through that. And then don't be afraid, as a fellow I'm working with tells me, to dip your toe in there. Because if you try to act like it couldn't happen, then you're not being realistic. It could. I could lose her. That would really suck, but I could. So you've got to be able to dip your toe in there and think about what your life might be like if she wasn't there. But you can only dip your toe in it. You can't wallow in it. Because if you wallow in it, then you're not getting anything done.
They said stage 4 lung cancer. Well, we live on the Central Coast, and San Luis Obispo is a beautiful area, and the oncologist is really good there. But we said, we want to find the best. Who is the best? And they got us set up with Dr. Goldman here at Premiere Oncology. And part of what we wanted was definitely an integrative approach, because I tend to go for more naturopathic ways. I believed I needed to build the best team possible, because we would be in our area where we live 4 hours away, and also down in Santa Monica. So I wanted to build a team that would work well together. And all the doctors agreed that they would be able to do that. And if they couldn't do that, I would have found different doctors.
With all of the treatments available to patients now, I think one of the things a patient needs to look for in a doctor is someone that will oversee everything and be in some way at the quarterback for them, to help bring everything together. Everyone hears from friends, family, from the internet, from television, all kinds of other therapies that may be helpful. I think, and I always do encourage my patients to approach them with eyes wide open, and to understand that most, if not nearly all, of these complementary therapies are not well studied, and that we still have a lot to learn about them. Nevertheless, I've certainly seen patients that have had benefit from treatments such as acupuncture, certainly massage, certainly other types of support, like a support group with other patients. Those can really be, in many ways, as important as the chemotherapy or other cancer therapy in a patient getting through treatment feeling as normal as possible. It is through open communication and trust that patients and doctors get the best outcomes, they feel the best, and really can have a team that works.
When I was diagnosed, I met with the radiation oncologist, the regular oncologist, and I think there were 5 doctors involved at that point. Plus, where we live in San Luis Obispo, they have a tumor board as well. So I had so many doctors chiming in on my diagnosis. And they said, well, you need to start chemotherapy and radiation right away. In the meantime, I had come down to see Dr. Goldman for the first time here at Premiere Oncology. And he said, no, let's wait. And that decision to say, let's wait, when I had the chemotherapy scheduled the next day, I had to look at him. I had no other knowledge, but I looked at him and he said, would you be comfortable with that? And the way that he talked to me, he was telling me that I could trust him. And I had to, my life was in his hands at that moment. I said, you mean wait and not do it? He said, we're gonna do genetic testing on you to see if you have the mutation that will take the Tarceva drug. So I said, okay, I'll trust you.
Well, I think it is very helpful to compare what's happened in lung cancer to other tumor types. Of course, a lot of advance of the last 30 years has been in breast cancer. And there, we've identified these subtypes of breast cancer based on some of the proteins that are on the cell surface and some of the genetic changes. And that has really categorized subgroups of breast cancer that will respond better to different treatments. And in many ways, that was the beginning of the personalized revolution for cancer therapy. The identification and the exploitation of these mutations and what is driving the cancer cell allows us to develop truly silver bullet type treatments that affect the cancer cell with minimal effect to other cells. And that really is the goal of all cancer therapy.
So I had to wait 2 weeks while that genetic testing went on to find out what was happening. In those 2 weeks, my symptoms progressed to the point where I was coughing constantly. And before I had been asymptomatic, but within this 3 or 4 week period of diagnosis, I had really developed symptoms. And then this arm, I couldn't even raise above my head because I had one of the metastases was sitting on a nerve. But I had trusted my doctors at that point to say, I can wait. And I'm very glad I did, because I did test positive for the mutation that let me take Tarceva.
You need to be able to communicate, and you need to be able to share that with your spouse. You have to. She's your partner. She's the one you chose, and hopefully she chose you too. That you have to do that. So, sure, there's been plenty of times that we've sat there and cried and everything to each other and expressed the fear that I don't want to lose you and I don't want to have a life without you. I want you here. You can't wallow in it. You express it, because if you don't express it, it's just stuck inside you. If you can express it, you can then deal with it and you can then move on.
The hardest part is to keep your own self afloat. I had to realize I have to put myself first or I'm not going to be around. I found there is so much hope out there. Do not read the statistics that you see on the internet because technologies are changing, treatments are changing. I was very active in yoga. I was back doing yoga within 3 weeks that I started on my treatment. I ignited my support network, which was all my friends, anyone I'd known from my life in different places in different countries. All of a sudden, I didn't realize how important it was that people rallied around me and said, in effect, we care about you, we are here for you. And that made a huge difference in my will to survive. Of course, I have a 3-year-old daughter and my wonderful husband, so I wanted to live, but then to feel the life force around me and everybody coming together in a network.
Some wise folks were reminding me to take care of me, and that if I'm not in good stead, I can't take care of them. Being able to do just a little bit and take a little bit of time like that to whatever it is that sets your mind on balance and gives you rest is critical, because then you can help them.
How do you communicate to your child was the biggest challenge I faced. And with a 3-year-old, they're very literal. They see things. They don't understand the word cancer. I did cut my hair. I had long hair. And just to make life easier for myself, I just decided to cut my hair. And so she associated with short hair with the disease. So she says, when mommy's well, she'll have long hair again. You know, physical things. She says, she saw my rash. Oh, your rash is getting better. And also because I had so much back pain, it was my back. So she would come and say, I'll give you a massage on your back. You know, our mommy has back pain. And what we did is keep her in her routine. That was the most important thing, was to keep her routine as much as possible.
One of the things that we were really disciplined about was recognizing and taking time out for enjoying and saying and loving our life. And you know, I remember 3-4 weeks before we got this diagnosis, we're sitting there talking, and we just were, you know, in shock about how much we loved our life. And we just loved where we lived, who our friends were, our families, you know, our daughter, even our dog. I mean, we just were happy. I
started a blog to help other people going through this called fightlikeamother.com. And it's for mothers with cancer, but it's also for any parents that are struggling, because really when, you know, someone gets cancer, the family gets cancer. But I think as mothers, we want to come out swinging and fighting against the disease.
We always knew we loved what we had, and we fought like hell to get it to get it the way it was. But the ability to reach out and touch it even more closely and hold it even more dearly, I guess that's the way it changed.
Very early on, I read some very uplifting things and I realized that this would be a portal. That cancer, I was going to use it as experience. If I had 50 days to live or 50 years to live, then cancer was going to be my portal into fulfilling my life as best that I could. And that has changed everything, really.